Hi friends, good evening. Welcome back to my channel Mugambika Nursing. Friends, here we are discussing questions for RRB Nursing Officer exam preparation, and also these questions will helpful for your coming other nursing officer exam preparation. Jimber exam is coming, also DME, we are waiting for DME exam, AIMS NOSET exam. In the previous video, we discussed previous year questions and answers till 60 question. Today we can see question number 61 onwards. Question number 61, this is a non-nursing question. This question consists of nursing and non-nursing question. We are focusing nursing questions only, but at the end, that is coming to exam time, we can discuss GK questions together. So this is the question number 61. What is the maximum strength of Rajya Sabha? What is the maximum strength of Rajya Sabha is the question. So and the correct answer is, it is 250. Maximum strength of Rajya Sabha is 250. And the next question, how many chambers are there in the heart of fish? Options 5, option B 2, option C 3, option D 4. How many chambers are there in the heart of a fish? And the correct answer is, it is 2. Option B is the correct answer. Next question, which among the following do the phagocytic actions? Among this, which have phagocytic action? Basophils, polymorphs, option C eosinophils, option D neutrophils. Phagocytic actions are mainly by neutrophils. Option D is the correct answer. And the next question, expected date of delivery is calculated by using options. Option A, Nagel's formula, option B, John's formula, option C, Robert's formula, option D, Wood's formula. Expected date of delivery, among this option, expected date of delivery is calculated by using formula is Nagel's formula or Nagel's rule. Option A is the correct answer. The next question, the first nursing philosophy on health maintenance and restoration was established by. And the options, option A, Mary Eliza Mahoney, option B, Dorothy Dix, option C, Florence Nightingale, option D, Clara Barton. Question, the first nursing philosophy on health maintenance and restoration was established by whom? That is the question. So it is by Florence Nightingale. Option C is the correct answer. Question, the process involved in the development of a mature ovum is called. Options, option A, spermatogenesis, option B, fertilization, option C, oogenesis, option D, gametogenesis. Question, the process involved in the development of a mature ovum. So the development of mature ovum is called oogenesis. Option C is the correct answer. And the next question, during the implementation phase of a nursing process, a nurse needs to be competent in which of the following skills? Options, option A, cognitive skills, option B, interpersonal skills, option C, psychomotor skills, option D, all of this. So here the question, during implementation phase. So implementation phase means we are implementing the care to patient. So planning and implementation. We are planning particular care and implementing. We are applying to patient side. So that time we should, as a nurse, she or he should have cognitive skills, interpersonal skills and psychomotor skills. So the correct answer will come all of the above. On to the next question, myopia is corrected by using options. Option A, cylindrical lens, option B, concave lens, option C, convex lens, option D, bifocal lens. Myopia is also known as nearsightedness and it can be corrected by using concave lens. So here correct answer is option B, concave lens. And the next question, change in the velocity of an object per unit time is called. This is also one of the non-nursing question and the correct answer is acceleration. Change in the velocity of an object per unit time is called acceleration. And move on to the next question. What is the physiological response of the ear to the intensity of sound? Physiological response, that is the question. Options: option A, energy, option B, loudness, option C, inertia, option D, transmission. This question: the arterial blood gas analysis report shows that a decrease in bicarbonate level and pH value denote. Options: option A, respiratory alkalosis, option B, respiratory acidosis, option C, metabolic acidosis, option D, metabolic alkalosis. Question: in arterial blood gas analysis report that denote decrease bicarbonate level and decrease pH value. That means it is metabolic acidosis. Option C is the correct answer. The next question: the surgical removal of the entire content of the orbit including the eyeballs and eyelids is. Options: option A, exenteration, option B, evisceration, option C, laser surgery, option D, enucleation. Question: surgical removal of entire content of the orbit part including eyeballs and eyelids whole, that is entire content of the orbit, eyeballs and eyelids, is known as exenteration. Option A is the correct answer. And the next question: the overall plan or blueprint for answering this research question is called. Options: option A, hypothesis, option B, sample, option C, research design, option D, analysis. Question: overall plan or blueprint for answering the research question is known as a research design. Option C is the correct answer. And the next question: amoebic dysentery is caused by. Options: option A, Balanidium coli, option B, Giardia lambelia, option C, Amoeba proteus, option D, Endamoeba histolytica. Amoebic dysentery is caused by Endamoeba histolytica. Option D is the correct answer. And the next question: which one of the following is not a common cause of increased intracranial pressure? Options: option A, viral encephalitis, option B, subarachnoid hemorrhage, option C, migraine headache, option D, brain tumor. Question: among the following, which one disease we can't see increased intracranial pressure? So increased intracranial pressure we can see in case of viral encephalitis, subarachnoid hemorrhage, brain tumor, but in case of migraines there will not be increase intracranial pressure. So that will come correct answer, option C. And the next question: what is the number of chromosomes present in the gametes, that is egg and sperm of human being? Number of chromosomes. Options: no chromosomes, option B, 22 pairs of chromosomes, option C, 3 sets of chromosome, option D, 1 set of chromosome. And the correct answer is, what is the correct answer is 1 set of chromosome. That is what is the number of chromosome present in the gametes, that is egg and sperm of the human being. Correct answer will come 1 set of chromosome. And the next question: increased glucose tolerance is seen in. Options: option A, hypopituitarism, option B, hyperinsulinism, option C, hypothyroidism, option D, all of this. Increased glucose tolerance can seen in all of this: hypopituitarism, hyperinsulinism and hypothyroidism. Option D is the correct answer. And the next question: an overgrowth of bones and soft tissue is seen in. Options: option A, acromegaly, option B, tetany, option C, Cushing syndrome, option D, goiter. An overgrowth of bones and soft tissues we can see in case of acromegaly. Option A is the correct answer. This question: the force of attraction of the earth on an object is known as. Options: option A, friction of the object, option B, weight of the object, option C, mass of the object, option C, motion of the object. And this is also non-nursing question, and the correct answer is weight of the object. And the next question, an accumulation of blood in the intrapleural space is known as. Options, option tension pneumothorax, option B pneumothorax, option C chylothorax, option D hemothorax. Accumulation of blood in the pleural space, intrapleural space is known as hemothorax. Option D is the correct answer. And the next question, what information the nurse should consider while collecting the history of a child with suspected rheumatic fever? And the options, option A vomiting for 2 days, option B a recent episode of pharyngitis, option C lack of interest or in food, option D a fever that started 2 days ago. Question, while collecting history or while asking history from the patient, what information does the nurse should consider a patient or child suspected with rheumatic fever? So we have to collect a recent episode of pharyngitis. Option B is the correct answer. And the next question, which mode of inheritance is found in cystic fibrosis? Options, option A X-linked recessive, option B multifactorial inheritance, option C autosomal recessive, option D autosomal dominant. Question, which type of inheritance is found in case of cystic fibrosis? And the correct answer is autosomal recessive. Option C is the correct answer. Cystic fibrosis means is a multi-system disorder. So it affects the different systems of the body and it is an autosomal recessive trait disorder. So that is the question, autosomal recessive disorder which is characterized by exocrine gland dysfunction. And the next question, which process comes under a child expected to learn directly from nature through personal experience? Options, option A realism, option B idealism, option C pragmatism, option D naturalism. Question, a child expected to learn directly from nature through personal experience is known as naturalism. Option D is the correct answer. Next question, isotope of cobalt is used in the treatment of which of the following disease? Options, option A AIDS, option B cancer, option C anemia, option D goiter. Isotope of cobalt is used for the treatment of cancer. Option B is the correct answer. And the next question, sperms are produced by the process of. Options, option A gestation, option B oogenesis, option C ovulation, option D spermatogenesis. Sperms are produced by the process of spermatogenesis. Option D is the correct answer. Question, this is also one of the non-nursing question. Where is the Jallianwala Bagh situated? Options Kolkata, option B Amritsar, option C Lucknow, option D Surat. Jallianwala Bagh situated in Amritsar. Option B is the correct answer. And the next question, when the body mass index of an adult is below 18 kg per meter square, the condition is termed as. Options underweight, option B obese, option C overweight, option B pre-obese. So body mass index below 18 is termed as underweight. Option A is the correct answer. Sociology helps the nurse to know about. Options, option A social life, option B politics, option C personal life, option D community. Sociology helps the nurse to know about social life. Option A is the correct answer. Move on to the next question. The exact written report of the conversation between the nurse and the patient is. Options, option A nurse's record, option B non-verbal record, option C process record, option D process report. The exact written report of the conversation between the nurse and the patient is known as process record. Option C is the correct answer. And the next question, cerebrospinal fluid is secreted by. Options, option A cerebrum, option B choroid plexus, option C cerebellum, option D spinal cord. CSF is secreted by choroid plexus. Option B is the correct answer. And the next question, a person who works hard to increase his wealth is satisfying his. Options, option A social motives, option B secondary motives, option C biological motives, option D personal motives. And the correct answer is, it is personal motives. person who works hard to increase his wealth is satisfying his personal motives. Larynx is closed during swallowing by options. Option A, cricoid cartilage. Option B, thyroid cartilage. Option C, vocal cord. Option D, epiglottis. During the time of swallowing, the larynx is closed by epiglottis. Option D is the correct answer. Next question, which of the following is an airborne disease? Options, option A, cholera, option B, measles, option C, hepatitis A, option D, typhoid. Among this, which is an airborne disease spreading through air? It is measles. Option B is the correct answer. Remaining cholera, hepatitis A, typhoid or waterborne disease. But this measles is spread through airborne. This is the last question. So we discussed 100 question over here. Mostly all nursing question we discussed. This is the last question. Which of the following entities is not included in COPD? Chronic pulmonary obstructive disease. Options, option A, asthma, option B, pneumonia, option C, emphysema, and option D, chronic bronchitis. So in COPD, asthma, emphysema and chronic bronchitis is there, but pneumonia is not included in COPD. Option B is the correct answer. So far we discussed one of the previous year RRB nursing officer exam questions and answers. Surely these questions will helpful for your exam preparation. In the coming videos we can see important questions, also expected questions for RRB nursing officer exam preparation.